This patient was referred to me for endodontic retreatment of tooth number 31. Patient states a few days ago he noticed a pimple or ulceration or a blister, he called it, on his gum. Went and saw his dentist and was referred to us. Upon examination, I found a sinus tract on the buccal aspect of tooth number 31. The lingual part of the tooth was cracked and missing, and you can see a large amalgam restoration, old amalgam restoration here. I also noticed crack lines in the remaining coronal part of the tooth. Probings were 2 to 4 millimeters all around. And you can see a periapical relucency associated with the tooth also. This is the sinus tract, as you can see right here. That's the tooth. You can see the lingual part of the tooth is missing, and these are all old amalgam restorations, as you can see. Seems to be patient grinds his teeth as well. You can see how flattened the teeth have gotten. So I went over options with the patient. Patient wanted to try to see if tooth could be saved. So that's what we did today. We went ahead and did the root canal for him in one appointment. As you can see, everything went beautifully. We went ahead and temporized the tooth and referred the patient back to his dentist for the permanent restoration. The tooth needs to be built up, and a full coverage crown needs to be placed on this tooth. This tooth is cracked, and I always tell my patients, a cracked tooth responds unpredictably to treatment. So if you like, I can do the root canal. Your dentist will build it up and crown it, and we'll see. If you don't like that option, the next option would be to extract the tooth and perhaps maybe put a dental implant there. So I always go over all of that with my patients. I don't just tell them or not tell them anything. The worst thing would be to not tell them anything. And the second worst thing would be to not tell them about the guarded prognosis, the very guarded prognosis for a tooth such as this one, and to not give them the option of extraction. All right, so that would not be good if I didn't go over everything in detail with the patient and went over options, prognosis, and what have you, and alternative treatment, which is extraction. So patient, as I said, decided that they wanted to try to save the tooth. Now, the other thing, you can see the root canal went beautifully, 2 mesials and 2 distal canals, distals joined. The other thing I want to talk to you guys about is that whenever I post a case like this, and you see something like that, and I get a bunch of comments. Oh, there's a broken file in there. I'm not saying that I've never broken a file, but if I break a file, don't you think that I would tell you? When I post a case like this, I would say, oh, by the way, this is a broken file. I broke a file in the tooth. If there's a broken file in the tooth, I will tell you. You get something like this, like a metallic radiopacity on an x-ray, is when the canals join and the gutta percha is condensed and compacted on top of each other. Like in this case here, the gutta percha and the sealer. Here, the gutta percha and sealer are much more condensed and compacted, and that's why it gives you that metallic look. All right, so let me show you another angulation. See? In this angulation, where is that broken file? If there was a broken file, there is no broken file. It's just the angulation of the x-ray and the way that the gutta percha join and kind of condense in that area. And then along with the angulation of the x-ray gives you the impression that perhaps maybe there's something metallic there. But as you can see, there's no such thing. There's no broken file there. As I said, if there was a broken file, I would tell you. I would say I broke a file when I'm posting the video. So these are all multiple angulation PAs that we take, and you can see everything went beautifully. Look at all of that anatomy there. Also, you can see 4 canals here now, and no broken file, of course. And this is just as I said, gutta percha overlapping. All right, very good.